Over to
Okay.
Smita Ben.
Thank you, Sanu, for my introduction. Good day, good afternoon, everyone. And first, I would like to thank Dr. Bansi Sabu for giving me an opportunity to come here. And today, my topic is the advanced carbohydrate counting. The diabetes management for the type 1 diabetes is not only challenging for patients, but is also challenging for the physicians as well as dietitians also. So I think there are so many dietitians here, and how many dietitians are going to teach their patients regarding the carbohydrate counting? Okay, fine. So the carbohydrate counting is become very popular nowadays, but its concept is very, very old. In 1921 in Europe, it was introduced, and this is the one of the successfully dietary approaches that used in the DCCT trial. So what the purpose of my presentation is to explain the carbohydrate counting approach and demonstrate ways for applying into diabetes nutrition management. So carbohydrate counting is a meal planning approach for diabetics which focuses on the carbohydrate as a primary nutrients which affect only postprandial glucose. So there are three type of the carbohydrate counting. First is the level 1. It's a basic and it's a traditional carb counting. Second is the level 2. And the third we will discuss about is the advanced carbohydrate counting. So now the simple, there are some which tools are required for the carbohydrate counting is very simple. First is measuring cup and spoons that is it available in the everyone house. Food weighing scale, nutrient values book, and carb counting books. Nowadays, so many applications are available so patients can calculate the carbohydrates. So now to start, the first always emphasis on the patient to identify the carbohydrate food because patient doesn't know that which food contains the carbohydrate, protein, and fat. So you must teach the patient that which food contains the carbohydrates like starch, fruit, milk, and sweets. Then the portion size. Portion size is the most important to explain the patients regarding the portion size is general estimation like katori and glass, teaspoon, tablespoon. Now measuring the carbohydrate servings, like one servings is equal to 15 grams of the carbohydrates and count the actual carbohydrates. Nowadays, there are so many foods available in the market, and earlier Kavita said that is a packaged food. It contains the fat and protein, so you must teach the patient regarding the how much actual carbohydrate to insulin ratio, and glycemic index and the glycemic load in the our diabetic food. So the main principle is healthy eating principle and the low saturated fat and high fiber and be active for this. Now the basic carbohydrate counting level 1. So first we will see regarding the level 1 carbohydrate counting is a very simple and very traditional. You can explain each and every patient. Suppose the patient is not highly literate, they can do it. The first people who desire less structured method of choosing food, patients learn why consistency carbohydrate intake is important in relation to blood glucose level and also learn about the foods that contain the carbohydrates, the concept of the carbohydrate choices, and how to count the carbohydrate. We will teach the patients in carbohydrate counting level 1. And patients are taught to keep food records, identify the portion size, and target range of the carbohydrates can negotiate with the patient. So this is a very simple hand guide for the sensible serving. So each and every patient can understand regarding the palm, tight fist, loose fist, one tablespoon, teaspoon. So this is very practical for the patients as well as for the dietitians. So this can you can you can keep this type of the picture and you can show the patients is very practical. This is the exchange list for work carbohydrate options. Their cereals is equal to 21 grams and pulses is 26 grams. So this exchange will be help the patients to count the carbohydrates. Now level 2. when patients complete the level 1, for the patients who have master level 1, the patients continue the master record keeping skill. That is the most important. You have to say the patient, you have to keep all the records regarding the food diaries, which food they had eaten. They had to say self monitoring, deal with the more complex foods such as restaurants, learn effect of the fiber, protein and the fat, and learn to identify the pattern of the blood glucose level that are related to food, insulin adjustment, and physical activity. Now, the basic carbohydrate. What are the basic carbohydrates? Is counting and emphasis on the portion control and use of the exchange list, making a simple accessible for individuals. And in the advanced carbohydrate counting, is incorporate the sophisticated insulin management technique such as insulin to carbohydrate ratio. That method allows the tighter glucose control and accommodating individual variation in the insulin sensitivity. Now the portion control, that is the most important because patient says that we are eating, but what the portion? So always emphasis on the portion control for the carbohydrate counting, the carbohydrate exchange list and the portion control. It will help the patient to current the accurate carbohydrates. Now, what are the benefits of the basic carbohydrate counting? You can see the carbohydrate counting simplifies the meal planning and empowers the individuals with the diabetes to make informed the food choices. It serves as a foundational food for the effective diabetes management, promoting better glycemic control and providing a sense of autonomy of the dietary decision. And there are some limitations for that, that while carbohydrate counting is a beneficial, it may lack of precision needed for those with the complex diabetes management requirements, and individuals seeking tighter glucose control might find it challenging to rely solely of this method, necessitating additional strategies for the optimal results. Now the label reading. That is the most important because earlier speaker Kavita has explained that the packaged food. And type 1 is a common in the children and they are using more packaged food. But the patient doesn't know how to read the food label. What they are doing, they are only seeing the expiry date of the package. You know, they don't bother about it. Otherwise, they will say the calories. But how much carbohydrate in this food, that is most important. You have to teach the patient. So calculate the gram of the carbohydrate per serving and per 100 grams, and calculate the number of the exchange per servings and per 100 gram. So carb counting equation for the counting tribe is carbohydrate in the reference food in grams divided by the weight of reference food and multiply by weight of your food. How much food you are having, that is your food. So this is per serving. You can see this label that per servings. Suppose patient is having 47 grams of this food, so how much he is in per serving? So carbohydrate divided by weight, the carbs per serving is 21 grams and suggested serving is 30 grams. So one serving is of the 30 grams. So divided by 30 and multiplied by y means actual how many weight food of you are using is 47 is equal to 33 grams of carbohydrate means 2 servings of the carbohydrate. So you have to count 33 grams of the carbohydrate in the serving of total 47 gram of weight. This is we can count as 100 gram is the same method. Now, carbohydrate counting for the foods contain the sugar alcohol because nowadays the desserts and some beverages are contain the sugar alcohol polyols. So we must consider in as a carbohydrate. So the total carbohydrate from the polyols, there are less than 10 gram of carbohydrate per servings. Do not count if 3 or less servings are eaten per day. But there are more than 10 grams of the carbohydrates per serving. You have to divide total carbohydrate in half the count. So you have to divide as half and you have to count as the carbohydrates. We will discuss regarding the advanced carbohydrate counting. So what is the advanced carbohydrate counting? This is the main is insulin carbohydrate ratio. The insulin carbohydrate ratio helps the individuals calculate the amount of the carbohydrates they can consume per unit of the insulin. The ratio is crucial for effective body glucose management, and it is ensure that insulin doses align with the carbohydrate intake. And the second thing, insulin sensitivity factor is indicate how much 1 unit of insulin will lower the blood glucose level. So understanding the insulin sensitivity factor is essential for adjusting the insulin dose as per the particular after meals. Suppose the patient's pre-meal sugar is hypoglycemia or hyper high sugar, so you can adjust to those use the insulin sensitivity factor is also called as a correction factor. So now calculating the insulin to carb ratio. The rule of 450 to 500, but generally in the insulin pump, they are using 450 and otherwise you can use 500. So insulin carbohydrate ratio is equal to 450. 450 divided by total daily dose. So this is the patient total daily dose is 36 units. So you have to 500 divided by 36 is equal to 30.8 is considered 14. So ratio is 1 to 14. So 1 unit of insulin will cover 14 grams of the carbohydrates. Now, the second method is also take a total daily dose minus basal insulin is equal to bolus insulin. So, suppose daily dose of the average and divided by the daily average carbohydrate intake by the bolus insulin. So, suppose Raj is the patient and his total daily dose is 20 unit minus 10 unit of basal unit is equal to 10 units bolus unit, and his average consumption of the carbohydrate is 220 grams per day. So you have to 220 divided by 10 is equal to 22. So his insulin carbohydrate ratio is 1 to 20. Now the calculating insulin sensitivity factor. So understanding the insulin sensitivity factor is a crucial for effective diabetes management, and it helps to patients to determine how much unit of insulin will lower their blood glucose level. The rule is 1800 divided by total daily dose. So this is the method that insulin sensitivity factor is 1800 and insulin carbohydrate ratio. You can count insulin carbohydrate ratio to insulin sensitivity factor also. So you insulin sensitivity factor multiply by 0.33, you can get insulin carb ratio. So this is an example. Total daily dose is 25 unit. So in ISF, and insulin sensitivity factor is equal to 1800 divided 25 is equal to 70 milli per deciliter. So 1 unit of insulin will lower 72, 72 milli deciliter blood sugar. And insulin carbohydrate ratio will be 72 multiplied by 0.33 is equal to 23.8 is equal to 1 to 24. Now the determining pre-meal insulin dose, how insulin sensitivity factor will help the patient. Suppose patient's pre-meal sugar is higher side. So how to calculate, how to correct it? So example is that the total daily dose 34 unit, target glucose level is before meal is 100 milli per deciliter blood sugar, and the pre-meal patient blood sugar is 226 milli per deciliter, and 60 grams of the carbohydrate are be to consume. The patient is going to consume 60 grams of the carbohydrate. So how to calculate? So insulin sensitivity factor is equal to 1800 divided by total daily dose is equal to 53, means कि 1 unit of insulin will lower the sugar is 53 mg deciliter. Now unit of insulin will be decreased. You have to decrease 126 126 millideciliter blood sugar. So 126 divided by insulin sensitivity factor 53 is equal to 2.3 units. He has to take extra 2.3 unit insulin. Now he is going to you going to uh, consume 60 grams of carbohydrate. So he needs his blood, his insulin carbohydrate ratio is 10. So and he has to take 4 unit of his for the carbohydrates, cover the carbohydrate, plus divided, sorry, insulin carbo ratio is equal to 500 divided by 34 is equal to 15, and is going to consume 60 grams, so he need 4 unit of insulin. But his sugar is higher side, to have to correct it, you have to add 2.3, so he has to take 6.3 unit insulin to cover the to correct his blood sugar level. Understand? Now, glycemic index. We must consider the glycemic index for calculating the carbohydrate. So, what is the glycemic index? That we all know that glycemic index is the ranking of the carbohydrate containing food based on their effect of the blood sugar level. Foods with a high glycemic glucose rapid spikes in the blood sugar. If you are having one slice of bread, definitely your sugar will be going high within 1 hour. Okay. And we have to consider also glycemic load. So glycemic load is evaluates the both quality and the quantity of the carbohydrates in the food, and this metric is crucial for understanding how specific foods affect blood sugar level, allowing to individual to make informed dietary choices to manage the diabetes effectively. So how to calculate glycemic load is very important. So glycemic index of the food multiplied by how much carbohydrate you are intake and divided by 100 is equal to glycemic load. So if the glycemic load is less than 10 is a low glycemic load, and if the glycemic load is more than 30, it's mean very high glycemic load. Now, what about the food? We discussed regarding the carbohydrates counting, but there are some foods that contain so many fats and so many proteins. So, how to calculate? So, you can see this graph that um, the both dietary protein and fat increases the postprandial glucose excursion in children with type 1 diabetes. You can see if the high protein and high fat diet is increasing the sugar after 300 minutes, means after 5 hours. So this is the how to calculate. This is the Panskova equation. This is algorithm to count the fat and the protein unit. So fat and protein is defined as 100 calories ingested from the fat or protein, and it's roughly approximate. So an insulin requirement equivalent to the 10 grams of ingested carbohydrate, it's important to extend the bolus. If your food is high in protein and fat, so you have to extend the bolus. So 3 hours for one fat protein unit, 4 hours for two for fat protein unit, and 5 hours for three fat protein unit, and 8 hours for more greater than three fat protein unit. So we have to count 10 grams of the carbohydrate is equal to 1400 40 kilocalorie is equal to insulin required for the 100 calories of the fat and protein. Now the Indian food, how to count the fat protein unit. So this is I have taken just chicken malai recipes, and in this chicken malai, 100 grams of chicken plus gravy, plus his patient is having two roti with 2 teaspoon of ghee. So now we count the protein is 32 grams plus fat is 26 grams and carbohydrate is 60 from two rotis plus 10 grams of fat and protein is 74. So total nutrition value is carbohydrate 60 grams plus protein 40 grams plus fat 36 grams. So calorie value of the only protein and fat is 384. So how to calculate fat protein unit is equal to 484 divided by 480, 440.8, plus you have to divide by 10 because it contains the 10 grams of the carbohydrate. So it will the 4.8. So you have to take extra 4.8 unit, and This is the for carbohydrate, he has to take 6 units because his carbohydrate ratio is 10, plus he has to add 4.8 unit is equal to 10 units total. So insulin for 60 grams, 6 unit before meal, because carbohydrate for me per meal. But for the protein and fat, he has to take an extended bolus. This is the extended bolus up to 5 hours, using bolus for about the 5 hours. So
Yes.
the conclusion is this is the nowadays the main limitations of the fat protein unit is recurring the hypoglycemia in the children. It was occurring the episodes of the risk of the hypoglycemia. So this is the latest studies was done in 2023, and they modify the algorithm of the food protein unit, and they count 200 kilocalories for that. So what's happened, and this is the very good study they had done for the type 1 patients, and this was done in the China. And the conclusion of this study was the modification for fat protein unit algorithm may improve the postprandial glycemic control after consuming the high protein fat meal in adult with the type 1 diabetes, but maybe result in increased hypoglycemia risk when used in the normal fat. You cannot use in the normal fat and protein diet. Now, earlier sub discuss about it. Our diet is full of carbohydrates, fat, and the proteins. So it's a really challenging to calculate all these things. So commonly Indian foods for that carbohydrate content, that rice 44 grams approximately 1 cup, chapati has 20 grams of carbohydrates, and lentils at 15 grams of carbohydrate per half cup. So these are the different glycemic index for the popular Indian foods. And Indian snacks, we are having that samosa, pakoda, and jalebi, all kinds of the carbohydrates plus fat plus protein. So incorporating Indian snacks, our snacks are very high calories, high carbohydrates and high fat. So the problem, so what are the problem in the carbohydrate counting is they manage the carbohydrate rich snacks platters, prove the challenging for individuals with diabetes, leading to fluctuated blood glucose and dietary patterns. So what are the solution for that? So by integrating the fiber rich food to giving the break for them. Okay. So this is the implementing the advanced carbohydrate counting. First step is educate the counting techniques to the patient. Step 2 is utilize each tools. Step 3 is the dynamic dosing adjustment, and then 4 is the adjust based on Facebook. So this is my takeaway message is the foundation techniques. What are the foundation techniques? Basic techniques from the foundation for effective management of precision control, and advanced technique enable to precision and tighter glucose control and personalized plan, and individual plan ensure the tailored diabetes management strategies. Thank you very much.